On a hot day in late August, first and second year medical students gathered together at the Emory University School of Medicine for the third annual Community Engagement Day. It's the capstone of a course called Community Learning and Social Medicine, required of all first years.
We have a course where we place students in their first year of medical school out in the community at 41 different community sites, serving vulnerable populations that include refugees, older adults, people with mental health issues, physical disabilities, and poor and underserved of all ages. And the idea is, in their medical training, they see a lot of medical, clinical things in the hospital settings and institutional settings, but they don't really learn about all the social determinants of health and all the other things that play out in a person's life. So we're sending them out to the community to learn more about the people that they're going to be serving as physicians. We place the students in the community organizations that serve these vulnerable populations so that the students can actually get real-world experience and see their future patients in their home settings and their natural environments when they're not in a crisis and when they're not sick, and really learn what their needs are. In the first half of the school year, it's really about observing and listening and developing their communication skills and learning from the actual people that they're going to see what their issues are day to day. And with that information, the second half of the year, they actually develop an initiative that meets a need that is in the community, and they implement a small initiative or project the second half of the year. So right now, we are at the end of this school year where we have a poster presentation. All of the now second year medical students are presenting the work that they did in their communities in a poster format for all the incoming first year medical students who are going to be continuing to serve in these communities. There's also classroom time that the students have related to this course. They have a number of lectures on racism, unconscious bias, privilege, ageism, all kinds of topic areas that we know are going to come up in the community settings that they're working in. And in addition to that, they are required to write reflections and process what they're experiencing in the community. This isn't just by itself, volunteer community work. It's also connected to who you're going to become as a physician and why it's so important to have this background and this experience in the real world and how it ties back to what you're seeing and learning in medical school.